My husband and I met in San Diego. We both went to UC San Diego, and that's where we, started studying science and trying to figure out what we wanted to do with our career. After graduating from UCSD, we both went to New York. I went to NYU for dental school, and he attended Columbia. And from there, we did our dental school, and we loved living in New York City, loved being there for the food, the restaurants, and getting a great education. After that, we decided we wanted to specialize. My husband decided to do orthodontics, and he went to University of Washington. I did a general practice residency, not sure exactly what I wanted to do. Went to a program through UCLA. It was at a VA hospital, and had a great time. After that, we moved to Washington, where my husband did his schooling at University of Washington, and I continued to work as a general dentist. Loved my jobs. It was great, but I kind of noticed that in my jobs, the patients that I was most looking forward to seeing were the kids. And I kind of just would be really excited when the kids were on my schedule. So after much thought, we moved to Arizona, where my family, my sisters were here, and we decided to just kind of work and start our family, and that's what we did. And again, my jobs I chose were primarily seeing kids. So after a lot of thought and consideration, I decided to go back to school and specialize. So I went to UC, I went to Rady Children's Hospital to do a dental residency program for 2 years. After completing my program at Rady Children's Hospital, we decided we wanted to come back to Arizona. We loved it here, my sisters were here, and I think our whole intention was we wanted to raise our family here and be around our family and be around this great weather. So we decided to come back here, and at that point I opened up my practice. For a while we worked separately. My husband opened his practice, I opened my practice, and it was great. And after 6 or 7 years, we decided, our patients really would like to see us both in the same office, and we felt we could provide comprehensive care in a really great setting. We both had great dental teams, and if we could combine them, we thought that would even be just a bigger asset to us and our patients. Prior to opening up our offices, both my husband and myself have worked at different offices in different states, in different kind of environments. We've worked in corporate dentistry, we've worked in private practices, and that really gave us, a really good experience on what we would want in a practice. And so we basically took our experiences, took the best, the good and bad from both of them, and built an office that we felt is a place that we would want to take our kids. So from the moment you walk in our door to the first phone call you make, we want our patients to have the experience that we would want to have if we were taking our son or daughter to a pediatric dentist or an orthodontist. And so we feel that that's probably our biggest accomplishment, is we've created an office where we know that our families, when they come here, they are getting treated just as if we would want our kids treated.